Hello friend, welcome back to my channel. Today we are going to learn about very important topic, that is trigeminal nerve. Let's get started. And as we know that in trigeminal nerve, it is the largest cranial nerve and it consists of the three branches, ophthalmic, maxillary and mandibular. So that in this video we are going to discuss about only ophthalmic nerve. In part 2 we are going to learn about maxillary nerve, and in part 3 we are going to learn about mandibular nerve. As we know that this is also called a fifth cranial nerve, and it got three branches that are ophthalmic, also known as B1, maxillary, also known as V2, and mandibular, also known as V3. We already discussed that trigeminal nerve arises from bones. That means 5th, 6th, 7th and 8th cranial nerve arises from bones, 2 from midbrain and 4 from medulla. Now let's draw a brain stream from which the cranial nerve arises. This is midbrain, this one is bones, and this one is medulla. From bones trigeminal nerve arises, and it consists of two roots, that is sensory and another one is motor root. And only the ophthalmic and maxillary branch gives sensory, while mandibular gives mixed. That means it gives sensory and motor both. After getting out from bones, the trigeminal nerve it makes a ganglion. This ganglion also called trigeminal ganglion. Ganglion means a collection of the cell body. After passing from a trigeminal ganglion, it passes a 3 axon, which is B1, B2 and B3. As we know that the V3 consists of both of sensory and motor roots, so that by mixing of the sensory and motor, it is passes through the foramen ovale, and V1 and V2 is passes from the lateral wall of the cavernous sinus. Lateral wall of cavernous sinus. After passing through the lateral wall of the cavernous sinus, B1 it gives a 3 branch that are frontal nerve, nasociliary nerve, and the third one is lacrimal nerve, and they are passing from superior orbital fissure. This is superior orbital fissure. Superior orbital fissure of skull. And the frontal nerve gives 2 branches that are trochlear nerve. As a name suggests, it passes to ear. And another is supraorbital, passes to eye. And now nasociliary, after passing through the superior orbital fissure, it gives a 4 branch, that is anterior ethmoidal, posterior ethmoidal, long ciliary, and the last one is infratrochlear. That means supratrochlear is the branch of the frontal nerve, while the infratrochlear is the branch of nasociliary. And before it gives a branch to 4 branches, it makes one ganglion. It makes a one ganglion, also called as ciliary ganglion. Now, after passing through the superior orbital fissure, the lacrimal nerve also gives a branch to lacrimal gland. Lacrimal gland. And another important thing is these two, anterior ethmoidal and posterior ethmoidal, goes upward to the anterior cranial fossa. That means anterior ethmoidal nerve and posterior ethmoidal nerve. They both goes upward to the anterior cranial fossa, and they goes down to the nasal cavity and gives a 2 branch, medial and lateral, and the lateral branch supply to the tip of the nose, medial and lateral. That means lateral branch supply to the tip of the nose, and also it is also called external nasal branch of anterior ethmoidal nerve. That's it, guys. Now let's summarize everything in brief. That is, the trigeminal nerve, also called a fifth cranial nerve, gives a branch of three branch: ophthalmic, maxillary, and mandibular. The ophthalmic and maxillary gives a sensory, while the mandibular gives a mix, that is sensory and motor. And the trigeminal nerve arises from the pons, and it is after passing from the pons, it passes through the trigeminal ganglia and gives a 3 branch: B1, B2, and B3. B1, that means ophthalmic branch, And B2 maxillary branch passes through the lateral wall of cavernous sinus, and after passing through the lateral wall of the cavernous sinus, it makes a 3-branch frontal nerve and nasociliary nerve and lacrimal nerve, and they are passes through the superior orbital fissure of the skull. After passing through the superior orbital fissure, the frontal nerve gives a 2 branch, that is supratrochlear and supraorbital. As a name suggests, supratrochlear means it gives and to the it passes to the ear, and supraorbital to the orbital means eye. And as after passes through the supraorbital fissure, the nasociliary nerve gives a 4 branch, that is anterior ethmoidal, posterior ethmoidal, long ciliary. From nasociliary it gives a long ciliary, and infratrochlear means in frontal nerve it gives supratrochlear, and from nasociliary it gives infratrochlear. And the lacrimal nerve after passes through the superior orbital fissure, it supply to the lacrimal gland. And the anterior ethmoidal nerve and posterior ethmoidal nerve, it goes upward to the anterior cranial fossa, and then it goes down to the tip of the nose, as it gives a 2 branch, that is medial and lateral, that only the lateral branch supply to the tip of the nose, and this is also called external nasal branch of anterior ethmoidal nerve. And this is the summary of ophthalmic branch of trigeminal nerve. Hope you like it, guys. And if you have any queries and if you want to ask something, then you can comment down below, and don't forget to like, share and subscribe. Thank you. Bye.